Hey everyone, welcome back to the BioNexus podcast series. Today we are going to be talking to Rebecca from Cleveland. We'll be discussing about Rebecca and her son as well. Rebecca and her child have recovered from Lyme disease and mold biotoxin illness, along with IBS, Crohn's, colitis issues. I'll let Rebecca get into the details of everything, but I just wanted to let you know that we've used completely herbal medicine, completely all natural protocols, and both mother and child are doing remarkably well. Especially Rebecca's son is doing really phenomenally well with the most minimal of interventions. Once again, completely natural and herbal medicine. So once again, please remember to subscribe, and let's proceed and welcome Rebecca to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
How are you?
I'm good.
So, today's podcast focus is going to be on yourself and your son as well, with many chronic illnesses, especially the ones that I specialize in, that's Lyme, biotoxin illness, autism. So that's one, the main purpose of this the podcast is to highlight the success stories with natural and herbal medicine, that it is entirely possible to achieve remission as well as recovery with herbal medicine. So isn't that what brought you to BioNexus Health?
Yes, because I was first tested positive for Lyme in 2007 and have done a lot of years of prescription antibiotics, antifungals, all of that. So I was ready to try something else. I've been with you for a little over a year, I think.
Yes, I think so. Yeah. So you tried conventional antibiotic approach for a couple of years?
Well, since 2007.
Right. Wow. Okay.
So off and on. I wasn't on antibiotics that entire time, but I'd be on them for years at a time, and then I'd be off for maybe a year or so, and just have my symptoms come back. So, yeah, I was ready to just try something else and see if I had better success this way. So,
well, are you glad you did?
Yes. I'm still not 100%, but I wouldn't say that I'm in, worse than I was trying it the conventional route. So we'll see. I guess I went into this feeling like the herbal and natural approach. I was expecting it to take longer. And it was much more of a lifestyle change, really focused on the whole picture, everything from mold in the house to diet to, focusing on how many toxins are coming in as far as everything, laundry detergent, shampoo, to just the whole big picture. So, yeah.
I always like to explain that it is important to look at the whole picture, including these little details that you mentioned, like we had to discuss all the way from your laundry washing machine, all the way, from Lyme to washing machine, to looking below your sink, to looking for, any other unknown leaks you might have in the house. Now that, have you ever considered mold to be a player as you were trying to recover, from Lyme over the years?
one of the doctors that I had did, she had me test the house, the ERMI, is that what it's called?
Yes.
And the house I was living in at that time didn't test real high. So we just kind of moved on and, but, last year, let's see, 2020 it was,
Mhm.
I was definitely living in mold. So, and it was going to take so much to remediate that house. It had a dirt crawl space, and we just decided to move instead. So we moved right before I started seeing you. So I think, one or two of the other doctors had mentioned it, but right, the first time it didn't seem to be much of an issue. And this last time I knew it was a huge issue, and we ended up moving because of it. Yeah.
Can you explain to me some of the symptoms that you had before you started the herbal protocol, and how have those gotten better?
Oh, definitely Candida was an issue, and I've been on nystatin and diflucan a lot over the past decade. And I really didn't see how I was going to. That one made me nervous, not taking nystatin, because I'd been on it. I'd been on nystatin for years. So, but here I am. It's been a year, and I've been off of both of those. Off of all prescription antifungals, and I'm actually feeling better. My Candida symptoms are better than they were. So I've definitely seen improvement there. Let's see. As far as, because I have Lyme, Bartonella, and Babesia, those are the things I've tested positive for. So I'm not really sure which symptom is which, but and then long COVID also. I got very sick with COVID in March 2020, and I still am not back. My energy particularly is still not back to what it was before that. And I would say brain fog too. I still struggle with since then.
So let me ask you this. When you got COVID for the first time, and you think that still, because many patients with chronic Lyme have been telling me that looks like after they got COVID, it seems that they were prime candidates to just kind of go into long COVID. So you're saying that your brain fog and fatigue got worse with COVID, and it has kind of stayed with you since then, you feel?
Yes. And I don't know whether to blame that on COVID or whether COVID is making the infections worse. The
Right.
Lyme and I don't know which it is, but yeah.
Right.
I've been, sicker, more fatigue and brain fog definitely since I had COVID than before.
Yes.
So,
and Dr. Shoemaker's research also tells us that extended use of antifungals, of prescription antifungals, is actually detrimental to patients that have chronic inflammatory response syndrome or biotoxin illness, especially the azole kind of antifungals, fluconazole, ketoconazole, itraconazole. So oftentimes patients who are on antibiotics for Lyme, just like you were for a couple of years, it's actually all age groups, including children, when they are put on long-term antibiotics for chronic Lyme or any other chronic condition. For example, with kids, it could be pandas type issues. If it is an azole family antifungal, like the ones I just named, that seems to complicate matters with MARCoNS, along with the symptoms that are caused by the Marcons, the Marcons being the sinus colonization with the coag negative staph bacteria, like I've explained to you, that happens with mold exposure. So that, in addition to what you're saying, there really isn't any research that has even been initiated. I know many ILAS practitioners have been discussing this avidly in the ILADS physician groups. And one of the things, all of us have agreed upon is it would be awesome to have some data which shows, like, just like you said, does COVID exposure actually exacerbate, or bring people out of remission from Lyme and co-infections?
Yeah.
You don't know.
Yeah, and fluconazole was one that I, was on a lot over the last decade. And we tested Marcons. That's the first time I had tested for that, was when I started seeing you. And I believe everything was negative this last appointment I had with you. So
yes, this last appointment, the first time I tested you, you were off the charts positive, right? You were like, what was it, 8 or 9 antibiotic resistance, including vancomycin and gentamicin. So that is, due to the long-term use of the azole antifungals.
right, but just like, I don't know, I think I was on your nasal spray for 6 months.
Yes.
Or so.
Yes.
And prior to that, I had tried a prescription spray. You probably remember the name of it.
Yes,
it's a
yes.
common one that they prescribe from a certain pharmacy.
Yeah, the BEG spray. You had tried the BEG spray for the Marcons, which didn't work. Yes, yeah,
Right.
yeah. I've been hearing. I'm not just hearing. I've had personally in my practice as well, had really good success with people with long-term exposure to the azole antifungals, just like you had, and then coming up with this seriously resistant Marcon colonization in the sinuses, vancomycin resistance and gentamicin resistance together. That is why it took you 6 months to clear. Usually, it takes about 4 months on the Formula 1 nasal spray. It's all herbal, as you know, but that's great. Yes, that was one of the things that I was observing, in your case, to see how long it would take, so we could kind of, establish additionally refined guidelines for using the herbal spray for such severe infections. So yeah, I'm glad that's gone. Yeah.
And I know another couple of symptoms that I saw resolve pretty quickly when I started with you was the thirstiness. I was just so thirsty all the time. And I've noticed with the minerals, the trace mineral supplementation, that goes away. And then diarrhea, I had a lot of trouble with diarrhea. And on the gut butter regimen, that completely went away. So
Beautiful.
Those were 2 things that I saw pretty quick improvement.
Yeah, that is, that was really awesome for me as well, especially because, you're an active mom, and it takes a lot out of you, taking care of a child that has medical conditions as well.
Right.
So I understand, like you mentioned, and of course I agree that you're still a work in progress, because your clinical situation is pretty complex, especially with COVID as well. Now, your son, he is 14?
Almost 16.
Almost 16 now, God bless. Okay. So he had a pretty fantastic response to the BioNexus herbal protocol. He did really well. Can you tell me a little bit about him?
Well, he was got really sick last spring, was eventually diagnosed with Crohn's disease. And I had read about the Scd diet helping with it. So we went ahead and started that, I think at least a month even before we saw you, because it takes a little bit to get in as a new patient. So I was kind of desperate how to help him. So I found that. So we started that just to try it. And within a week, his diarrhea stopped. I mean, he was having diarrhea a few times a day for months. He was losing weight, couple pounds a week there when it got really bad last spring.
Oh, goodness.
Sores in his mouth.
Sores in his mouth.
Yes. Like ulcers, I guess they call them.
Yes.
And so we saw dramatic improvement just from the Scd diet alone. And then as we saw you, and he starts on anti-inflammatory supplements and things, he's just continued to improve. So he's gained 30 pounds over this past year, grown a couple of inches. He's just really doing so much better. They want to do endoscopy and colonoscopy here later this spring, just to check inside to make sure everything is, mucosal healing, I guess the GI doctor calls it. So, but symptoms wise, his labs are all looking so much better. Because he wasn't absorbing nutrients, his iron was really low.
Yes.
Vitamin D was really low. So all of that's, looking better, and he's gaining and growing. So yeah, he's really not having any symptoms, at this point. So we're just really thrilled at how far he's come.
That's great. 30 pounds in a year, he gained weight. That is really good. And a couple inches, right? He's pretty tall. When I first saw him, he was, skinny and tall. And now he's nicely filled out.
He's still on the thin side, but he's into the normal range now. So yeah.
That is just, I know his recovery was so fantastic. It was absolutely wonderful to see him become symptom-free relatively quickly.
Mm-hmm.
That was really nice. Academically, he's able to keep up with his studies, with his peers. He's doing well. You homeschool him, right?
Yes, we are homeschooling this year. Yeah, so we're not sure what we're going to do next year, but and the year before he had missed a lot of school. He was enrolled in school then. The year he got really sick, so he had missed a lot, due to all of this. So homeschooling seemed like a good way to handle it this year, with being on the Scd diet and just still healing and recovering.
Good plan. Yeah. I remember doing a Scd diet with Brian, with my son, right? Ultimately modifying it as well. And we had quite a lot of benefit from using herbal protocols along with the Scd diet. Combining the two, helps achieve symptom remission pretty quickly. Crohn's, colitis, IBS, these can be misdiagnosed if there is mold exposure. I see that quite a bit in patients that have had that actually have biotoxin illness, which has resulted the amount of inflammation that occurs from biotoxin illness, spills over into the gut, and it turns out to be this textbook Crohn's, colitis, or IBS. And once the underlying inflammation or the root cause is addressed, that's when complete remission can be seen as well. And it's not like he's going to have to be on a diet for the rest of his life. And he's doing this completely without any pharmaceuticals.
That is true.
Right.
So far, so good. So,
Yes.
and I don't know how much mold played it, because by the time we saw you, he was starting to feel better. And so, spending the money for the Marcons, and I don't know, we decided not to do that just because he was improving anyway.
Yes.
But, we do know that he was in mold, because we were all in it.
Right.
So it very well could have, played a role in it. So, but yeah, and he hasn't done like the nasal sprays and all of that. Yeah, the main thing he's done is the diet and the anti-inflammatory supplements and things.
Okay, so he's just done the anti-inflammatory herbals and then the foundation supplements along with the diet.
Right.
He has not done any antimicrobials, right? Because you actually chose not to go down that path because he became symptom-free.
Right.
Yes, of course. I mean, once your immune system is back to being on the right track, once it's back to being in charge, and he's so young, there's no reason to mess with it any further. You just leave it alone and let the body heal. So I think you just, it was absolutely the right decision for him. Yeah.
And with him being a teenager, it's hard to get him to take too many
Right.
too many things. So
Right.
kind of picked, what's kind of the bare minimum we can do here. And if he's improving, we'll just kind of be happy with that.
Yes, exactly. So, can you summarize for me, Becky, what would you say to those, with Lyme who've been on antibiotics and antifungals for many years, and not achieving the kind of results, that they would like to see, that, having tried antibiotics for many years, and what would you say to those people about herbal medicine?
Well, it's worth a try. I mean, that's kind of what I thought. I'm going to give this a couple of years, just like I gave that a couple of years, and see, see what kind of improvements I will have with this route. But it's just like, I didn't see any downsides with the medications. You have so many downsides, and they're tearing up, at least in my case, they really tore up my gut. As I said, I was really struggling with a lot of diarrhea, abdominal cramping, things like that. And I believe it was all of the antibiotics. And I wasn't as careful with my diet either during those years. So, but yeah, I guess what do you have to lose? It's worth a shot. And right, the downsides just aren't there like you have with the antibiotics. So
that's important, Becky, that's important what you said, that when it comes to herbal and natural medicine, the downsides are just not there.
Right.
That's right. And just like you said, that is the number one issue that I see with people who want to transition over from antibiotics to naturopathic treatment, is that it has caused a lot of gut issues, right? A lot of side effects, a lot of gut issues. That's what happened with my son as well, which is what led me down to this whole BioNexus herbal protocol in the first place. But yes, did you find the transition from going off antibiotics and starting herbal, in your case, antibiotics and antifungals, like you mentioned, did you find it challenging? Did you do it cold turkey? Did you wean yourself off?
It was pretty cold turkey because I mean, once I switched, from a MD to once those ran out, that was the end. For some reason, I was more anxious about going off the antifungals for some reason. I don't know why. I think because the antibiotics, the doctors would switch them around a lot. So I'd be on this one and then that one. And the antifungals kind of stayed pretty steady. So I was kind of anxious to go off of those, but yeah, I did it pretty cold turkey, and it was fine. I had no reason to be so anxious about it, but so yeah.
So you went cold turkey off of everything after being on those a couple of years, antifungals off and on 10 years, you said, and you transitioned well. No issues.
Yeah, I mean, it's been a year ago, but I don't remember any problems. Like, there were only benefits. I just saw some improvements. Don't recall anything getting worse, only
Good.
better.
No, I don't either. I don't remember you telling me, of any adverse events. And there really isn't any reason to, it's not like you're transitioning off, psych meds where you need to, quote unquote, wean off of them little by little, to maintain your brain neurotransmitter levels steady. You have to slowly wean off the psych meds.
Right.
That doesn't really apply to antibiotics or to antifungals. It's just, you just stop one day and you start herbals. And sometimes, I do have patients that get nervous. That was the reason for asking me the question. It's like, no, should we wean off? I'm just to ease their minds. I'll be like, fine, go on half a dose, then go on quarter dose while you're building up your herbals to the full dosage, and then you can just drop off the antibiotics and the antifungals. Now, what did you do when you were building up on the herbal antibiotics? Meaning the herbal antimicrobials. Did you build up one drop at a time, or two at a time? Did you go like full dose all at once?
I built up slowly. Yeah.
Slowly, right?
The antimicrobials, especially, it was usually adding one drop in a day. Yeah.
Okay.
Or maybe every couple of days. It depended on what it was and if I felt like it was affecting me at all. And I always did one at a time. That way I knew which one was possibly causing. Some of them were, I don't know if you remember, Hawthorne, I think you had me on at the beginning, and I felt like it was giving me some heart palpitations, but because I had was just working on Hawthorne, increasing Hawthorne, I kind of knew that was what it was. So then I could back off and try it again a little slower or something like that. But yeah, I built those up slowly.
Good plan. Yes. And, so you start the antibiotics, you were building up the herbals one by one, like, one drop every couple of days. You did not find that Lyme and co-infections came rushing back, nothing of that sort, right? Your body accepted the herbals.
Right. Yeah. I don't remember anything, drastic happening. No.
Good. I think this has been awesome in the sense that, it has clarified very, very many common questions that are in the minds of people that are, wanting to transition from conventional to herbal medicine for Lyme disease, for mold exposure and what have you. So good. Thank you so very much for being here today. I really appreciate it, taking the time out and telling us about your story, your journey.
Sure. Any help it can be to others is, I'm glad it can be of use. My experience can be of use. So.
All right. Well, it's that time again. it brings us to the close of today's podcast. Thank you so very much for joining me. I appreciated it very much. I look forward to seeing you on the next episode. Until then, be well. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.